inside outside of class 2 cavities and restorations. Removal of silver filling in left lower third molar and class 2 composite restoration in a patient with claustrophobia and flaccid tongue without the use of rubber dam. Routinely, silver filling is removed under rubber dam on the particular tooth. This is to avoid spillage of the silver into the mouth of the patient and inhalation of the mercury vapor. The following is the video depiction of the procedure in the patient with claustrophobia and flaccid tongue. This is without the use of rubber dam. In these cases, it is very important to use high power suction and also extraoral high power suction with HEPTA filter. It is important to do cutting in small installments so that silver dust falling in the mouth can be cleared side by side. Care is also taken not to keep grinding at one place for a long time. Rather, keep shifting from one place to another. This is to prevent the thermal trauma to the pulp and post-restorative sensitivity. Just observe the flaccid tongue. Final stage of the preparation of the cavity. Our protocol for filling the composite filling is first acid etch, followed by application of sodium fluoride to block the duodenal tubules, and in deep cavities like this, GI lining. Removing the extra portions from the walls of the cavity. It was followed by the application of HN bond, waited for about 10 seconds and then blown off and cured. Spring matrix holder was selected and applied. Composite restoration was done with 3 amps bulk fill. In the beginning, however, bulk fill flowable was used. Initially, mesial and part occlusal filling was done. Rest of the filling was done after the removal of spring matrix. This was followed by removing the high points and finishing and polishing. To reduce inhalation of mercury vapors by the patient as well as the doctor, extraoral exhaust with HEPTA filter is used along with intraoral suction.